So, hello everyone, ladies and gentlemen. I hope you're all doing well. So, welcome back to another episode. So, today we will discuss about renal failure and the function of the kidney, how kidney functions. So, let's scroll down. So, what is kidney failure, or we can say renal failure? Kidney failure occurs when kidney lose their ability to sufficiently filter the waste from the blood. As we all know that human being normally consists of two kidneys, left side or right side. So both kidneys has the ability to sufficiently filter the waste from the blood. So here you can see the right kidney, left kidney, and then right ureter, left ureter, then right ovary, left ovary. This is basically the structure of the female body. In the nephron, basically kidney consists of a large number of nephron is a tiny blood vessels that collect the urine, and each kidney almost contain 1 million nephrons. So what are the types of the renal failure? There are basically two types of renal failure: acute renal failure, that is sudden, that is done in I guess 2 to 3 days, and that show the symptoms. And in chronic renal failure, that failed over the time, that basically progress over the times. So in acute renal failure, acute kidney failure is the rapid loss the kidney ability to remove the waste and help balance fluids and electrolytes in the body. As I already told you, in acute renal failure, it mostly in this case the rapid means the less than 2 days or 2 to 3 days. It might fluctuate. It may progress to end stage renal disease, uremic syndrome, and death without treatment. So, what is the classification of acute renal failure? In pre-renal failure, intra-renal failure, and the post-renal failure. So basically, three classification of acute renal failure. Pre-renal failure is a failure before the disease, and intra-renal failure when the disease is present, and the post-renal failure when the renal failure has been done. And then what are the failure you mostly observe, or you can say that you mostly experience after the kidney disease? So classification of acute renal failure. In pre-renal failure result from impaired or reduced blood flow to the kidney. Possible causes are shock, hypotension, anaphylaxis, ischemic formation. However, in intra-renal failure result from acute damage to renal structures. In renal structure, I guess I already told you that the nephron structure are not doing well, so that is why the mostly damage to the intrastructures. So possible causes of intrarenal failure is acute glomerulonephritis, pyelonephritis, may also result from acute tubular necrosis, damage of kidney structure from exposure to toxins, solvents, drugs. Mostly the drugs include is NSAIDs, non-steroidal anti-inflammatory drugs like naproxen, ibuprofen, heavy metals. So acute tubular necrosis is the most common cause of acute renal failure. The post-renal failure result from the condition block of urine outflow. When there is a complete block of the urine outflow, the condition is called post-renal failure. Possible causes are obstruction of urine outflow by calculi, tumors, prostatic hypertrophy. So here is the classification of acute renal failure. In acute kidney failure or renal failure, there is basically clinical history is present, that is medical history, allergies, then physical examination, blood pressure. You need to examine weight, fluid structure, urine output. Then after doing some laboratory tests like the chemistry test, chemical chemistry assays, urine test, and then you can diagnose that this patient has acute kidney failure. So as you scroll down lower, the acute renal failure or the causes of the acute renal failure. So something is stopping blood flow to the kidney is basically the failure of the kidney to do function. So that might be an infection, that might be the liver failure, that might be the medication, and as I already told you, ibuprofen, aspirin, naproxen, or COX-2 inhibitor. That might be due to blood pressure, medications, heart failure, severe burns, or dehydration, blood or fluid loss. So these are the major causes that normally a person experience when he has a renal failure. In acute renal failure, the causes are a condition that blocking the urine from leaving the kidney. As I already told you that the kidney has a function to perform, and that function is to filter the blood. And then after the blood is filtered, and to pass out the urine from the kidney. If that function is blocked, it means there is a failure in the function of the kidney. So a bladder or cervical, colon, prostate cancer, blood clots in the urinary tract, and enlarged prostate, kidney stones, and nerve damage in your bladder that mostly associate the acute renal failure. In acute renal failure, the causes are something has directly damaged the kidneys. Either they are blood clots, either they are cholesterol deposits, either they are medications, either they are glomerulonephritis, as I already told you about all these. In acute renal failure, symptoms, as I already told you, bloody stool, seizures, nosebleed, high blood pressure, changes in the mental state, changes in the taste of the mouth, decreased appetite, flank pains, high blood pressure, swelling in the body due to detention of the water and the sodium, urination changes, color of urine changes, urine completely stop, or more urine you can urination at night. Sluggish movement is also associated with it. In acute renal failure, diagnostic tests need to be performed to check either it is failed or not. So history is most important, serum creatinine is most important, elevated blood urine nitrogen is most important, and the normal values has been written as serum creatinine normal is 0.6 to 1.2 milligram per deciliter. Blood urine nitrogen is basically 8 to 25 milligram per deciliter. Creatinine clearance is basically the amount of creatine that is cleared off per unit time from the kidney is creatinine clearance, and its value should be 90 to 120 ml per minute. So these are the values. If a patient experiences hyperkalemia, it means it has a more potassium inside, and the kidney does not allow to remove the potassium from the body, so that is associated with hyperkalemia. Metabolic acidosis, kidney ureter related radiography, renal CT MRI, and retrograde polyogram. So in the next video we can discuss how we can treat the acute renal failure. So up till now, if you have any query, let me ask any query in the comment section. I hope